If you show up to my office with heel pain or foot pain, then we want to figure out where that pain is coming from. Is it plantar fasciitis? Is it tarsal tunnel syndrome? Is it something else? So how do we do that? How do we go about diagnosing you correctly so we can get you the right treatment? And for starters, we're going to talk. We're going to talk a lot about what's going on, figure out what exactly your symptoms are like, and then we'll go off into some tests, some orthopedic tests to push on the nerve, to pull on the nerve, figure out if we can reproduce any symptoms, if it matches up with more of a tarsal tunnel-like situation or something like plantar fasciitis or something else. And through our series of tests and through our history, our talking about what is going on, we will assign a rehab, an exercise, and treatment plan in order to get you walking down the right path. So let's look at a few things that we're going to do in the offices. I'm doing this on myself, so it's not completely clean and representative, but one thing we talked about in the last video is the tarsal tunnel is right here on the inside of the ankle, a very common place for the tibial nerve to get compressed and irritated. And to figure out if that is what's happening, we can just try to compress it and irritate it a little further. So we stretch that area underneath that tight band of tissue, and we're going to hold you in this dorsiflexed and everted position for a period of 15 seconds or so and figure out if you get any sort of tingling or numbness in the bottom of your foot. If you do, then you probably don't have plantar fasciitis because you've got some nerve irritation here. So we hold that, pay attention to what happens. You can do that by adding extra compression through the same test. We'll also tap on the area to figure out if the nerve is irritated here. I also want to know if your toe muscles are weak. If the foot muscles are weak, they can predispose this area to taking extra stress through your normal gait. So we can use the paper grip test, and we can pull away a card, or in the clinic, I'll use my foot strength, toe strength dynamometer to figure out what's going on there. I've reviewed that before in another video. And that way we can quantify exactly how strong your toes are, and if we measure them weak, obviously we're going to want to strengthen them. Another test that we can do here is to stretch the tibial nerve. Oftentimes, if we've got a compressed nerve and we stretch it, it will generate some pain. So in this position, I would take your foot back out to the side, so that dorsiflexion eversion, and then we will straighten at the knee until we develop some symptoms, potentially in the bottom of the foot. If that feels familiar to the pain that you've been experiencing, there's a good chance we're dealing with some heel or foot pain that is related to compression of the tibial nerve. In the next video, I'm going to discuss how I might treat myself if I were on an island. You don't always have somebody available that can help you target this kind of thing. So if I were experiencing this all by myself, those are the things that I would do. So we'll get to those in the next video.